Let's go ahead and roll the second video clip if we can. This actually shows the child in the OR about to go under. And Dr. Stowe, I'll let you take it from here. Dr. Hallway, perhaps I will let you, because you're in this clip, I think.
Yeah, this is the same patient. Now, she has received a pre-medication, and this is the anesthetic mask. This is the induction stage. These are some of the monitors that you can see placed. And the patient simply is kind of breathing the medications, and you can look at her eyes, and you can see that she's becoming a little sleepier.
And that's you on the right.
Yes, but there's nothing that's threatening about this. We try to ease the children off to sleep, and so it's just a very common way that anesthesia is started with a mask induction in a child this age.
Thank you so much for bringing that. Remember, our phone call bank is open. You can dial 704-371-8895 and talk with this medical team. As far as your the training, we talked about this also briefly before we went on the air. Your medical doctors, then you go in, and how much more training do you have to go through to reach this stage, Dr. Evac?
Well, I guess we should back up. First of all, it's 4 years of college education, then you apply to medical school. It's fairly competitive, or at least 20 years ago when I was there, it was fairly competitive. So if you're successful in that, then you enter medical school for 4 years of study, as any physician or any medical doctor or physician in the community has done. Mm-hmm. Then at that point, we all choose a subspecialty, whether it's anesthesia, surgery, pediatrics, internal medicine, and all do different residencies of different lengths. The anesthesia residency is an additional 4 years of training beyond medical school. Then in our group, actually, we like to subspecialize in a lot of areas. So
like what?
Well, the three of us are pediatric anesthesiologists, and actually have gone on to do. I did a year of fellowship at the Children's National Medical Center in Washington, D.C. Mm-hmm. We have another 10 or so other colleagues have trained at children's hospitals around the country. Brent could tell you he did pediatrics first, then anesthesia, peds anesthesia, and peds critical care. A whole lot of special education, and that's a service we really, our group felt more than 10 years ago the Charlotte community needed, long before the Levine Children's Hospital was envisioned, and it's taken us really a decade to bring 10 fellowship-trained, specially trained pediatric anesthesiologists, to our region.
Wow, it's interesting. Getting back to the children who are actually put under for these procedures, how soon are they awakened after the procedure? Dr. Stowe, you want to start with that?
Well, once the procedure is completed, the anesthetic vapors that we're giving, either through the mask or through a breathing tube, are turned off. Pain medicine is already on board, whether that's intravenous pain medications related to morphine through an IV, or sometimes we do regional blocks in order to help alleviate pain. And then once the anesthetic vapors are turned off, the patient breathes him or herself awake, and usually that takes anywhere from 5 to 10 minutes, somewhere in that range. Every patient is a little different. And we actually wake all the patients up in the operating room.
You do?
Correct. Make sure that we assess their breathing, their circulation, make sure everything is stable, that they're in a comfortable state, enough pain medication has been delivered to the patient. Once we're satisfied with the patient's condition, then we take them to the recovery room. Now, most people in the operating room, pediatric or adult, don't remember waking up in the operating room, but everyone is woken up in the operating room at the conclusion of the surgery.
Do they go back to sleep in OR? I mean, in recovery sometimes?
They're very groggy.
Yes.
They have gone from the state of unconsciousness to consciousness, but there's the residual effects of the anesthesia still last for many hours afterwards. Even though they wake up in minutes, they're still very groggy in the recovery room for hours afterwards, and that's where most patients remember waking up, is in the recovery room.
Right. If I could just add one thing for the audience, it's all the medicines that we use are sedatives, and they're different classes of medication, and some are specific pain relievers, some help with anxiety, some just allow people to fall asleep. But it's the synergistic effect of those sedatives that is important for us to monitor the effects for the patient and through recovery. because they can be respiratory depressants and they can have other effects on the body.